Tatiana, could you please tell us how you came to the decision to have bariatric surgery? What year did you have the surgery? What contributed to your decision? What made you consider this option, right? And what did you gain as a result of undergoing bariatric surgery?
I had bariatric surgery in April of 2019. More precisely, I reached out to doctors for help regarding this surgery. I had a mini gastric bypass done. The reasons that pushed me, my weight was 98 kilograms, almost 100, you know. So, the reasons. There were several reasons. First of all, I already had insulin resistance. I started having joint pain in my knees and hips. I felt like I was starting to fall apart. I wanted to be a healthy grandmother in the future. I realized that my son is 20 years old, and I need to be a healthy, energetic grandmother. I really needed to take care of myself right away. That was it. I hit some kind of limit. It was a turning point, and on top of that, I started having problems with my periods. So that too, there were irregularities starting. I realized I couldn't wait any longer.
I see. You had a slight excess in body weight. Maybe you just needed to do sports and stick to a strict diet. So why bariatric surgery?
I used to be a fitness trainer. That too, fitness didn't help me either. Unfortunately, seeing endocrinologists didn't help me either. Metformin. I've tried all of that. Apparently, insulin resistance is really a vicious cycle. Once you get into it, it's hard to get out without bariatric surgery. So I didn't see any other way out for myself. I've tried so many things.
Did you happen to tell your endocrinologist that you were planning to have bariatric surgery?
No. It just turned out that I didn't. We kind of lost touch over time, and in different cities too.
And after the bariatric surgery, did you ever see her again?
I actually left the city altogether. Now she's in Moscow, and I'm in Saransk. Basically, we went our separate ways.
How did you handle the surgery itself? What were your impressions of it? Was it hard? Was it easy?
Everything went perfectly for me. You should do it. I recommend it to everyone. My recovery was very easy. I was scared, probably like everyone else. There was that fear when you're already being wheeled into the operating room, ready to jump off the gurney and run away at the last second. That happened. But I haven't regretted doing it for a single second. I didn't have any serious complications after the surgery. Overall, I'm happy and just keep thinking, why didn't I do this sooner? The only thought is, why not earlier?
What did your family say when you lost 30 kilos?
Well, my husband is happy. My husband is happy. I think the kids are also happy to see their mom looking more beautiful, of course, than before.
So, over 2 years or a year, you lost 30 kilos. And what changes happened, besides your overall life improving, your social, sexual life? Yes, your life got better. What changes happened in your appearance? Why did we start meeting and talking regularly in the operating room after that?
Well, as soon as, yes, some changes happened with the weight loss, that initial euphoria started to fade because I saw that my body was sagging too. Everything was slowly sagging. The first thing that bothered me the most was my stomach, because it was hanging down like a very sad apron, and the first thing I wanted to fix was that, so that's how I ended up coming to you for an abdominoplasty.
What other problem areas did you have besides your stomach?
Besides my stomach? Well, problem areas, in general, probably appear all over the body, but you can't fix them all at once. And so, what was the top priority? So first, along with the abdominoplasty, we also decided to address arm surgery. We also did a brachioplasty, since my arms were a bit saggy too, and I just didn't want to leave them like that anymore.
Well, if they were just a little saggy, maybe you didn't need to do it.
Was it necessary? It was. It had to be done.
And what about the scars that formed afterwards?
The scars. I've gotten used to them. Like, I still think that any day now I'll get a delicate, beautiful tattoo there or cover it up with flesh-colored permanent makeup, and everything will be just fine.
So it turns out that for patients who have lost a significant amount of weight, it's not enough to just lose the weight. You definitely need to get your body in shape afterwards.
Of course.
And the second important point, it turns out that for you, having a good, beautiful body contour is fundamentally more important than having no scars, right? So what comes first? Is it more important to have no scars, or to have a nice contour even if there are scars?
Let there be scars, as long as the contour is beautiful. I can just wear a 3/4 sleeve, and no one sees my scars. And everything's fine.
But the shirt fits well. Yes, of course, the shoulder fits into the sleeve.
Yes.
Tell us, what were your sensations after undergoing abdominoplasty? Many people are very afraid of this surgery. They say it's hard to go through, that the pain is very intense, and that recovery is difficult. Tell us about your sensations afterwards. How do you like the contour? Are there any problems with the contour of the anterior abdominal wall?
But as for your abdominoplasty, I'm thrilled. Everything is just great there. I have an excellent scar. So, what problems do I remember? You know, I don't really remember any particular problems. I remember that I followed all the doctor's recommendations. As soon as they told me to start moving, I did. I walked slowly, taking it easy. Then I started walking up and down the stairs. On the 3rd day after my abdominoplasty, I went up 5 flights of stairs about 5 times in one day. Well, slowly but surely. I knew I was in Yakutsk. In a week I had to fly out, and I needed to be almost as good as new. So I had to get around on my own, get to the airport, and make the flight.
So when the swelling went down and everything healed, was it a big relief?
Of course. Yes, everything turned out really, really great for us.
Because your clothing size changes. You can allow yourself to wear a fitted dress.
It's just incredible. Yes, of course. I shared photos with the bariatric group. Everyone really liked them. The results of the work, overall, yes, were really top-notch.
So what brings you to us this time?
Well, now we're moving forward. Now it's the legs. Now I've come for my legs. Of course, on the thighs, especially the inner thigh, above the knee, and the inside of the knee, the skin has sagged the most. And no matter how much I tried to come to terms with this in the shower, I realized that I don't want to live like this and that I'm going to do something about it. To be honest, I was more afraid of this surgery than the abdominoplasty. Well, I don't know. Honestly, I was more concerned about the aesthetics here. To be honest, I didn't know how my husband would react to the scars that would run along the inside of my thighs. I was really worried about that. Then at some point, I had an honest conversation with him, found the right moment, and after we talked, I felt at ease. That's it. I basically got his approval. He said, "Do you need this? Then go ahead."
How did you physically feel after the surgery? Is it more difficult than an abdominoplasty, or easier? In terms of sensations?
Well, since for me, it seems like it was actually a bit easier in terms of pain, as you said, Natalia Semyonovna. But the only thing is, since they removed a vein at the same time, in the area where the vein was taken out, I do feel some pain points there. Right near the groin, near the knee. But overall, I feel good. So, it turns out that a day after the surgery, I actually walked on the very first day, and after 24 hours I could already bend down and touch the floor with my fingertips and stay in that position, and even enjoy it.
Tell me, how many days has it been since your surgery today?
Let me see. Today is Monday. No, today is Wednesday morning, so it's the 2nd day. Yes, I'm being discharged home today.
Are you comfortable in the compression garment?
Yes, honestly, I already love it. Anyone who's had surgery more than once knows that compression garments are really our #1 helper. You just can't do without them.
Do you need any pain relief today?
Honestly, no. Honestly, no.
Are you feeling comfortable enough?
There are, of course, a few minor things, right? Like when you stand up or sit down, but to say, give me a painkiller shot, no, nothing like that.
And that's considering our patient didn't just have a medial thigh lift, but also extensive liposuction on her back and thighs. The surgery was combined not just a thigh lift, but a rather extensive procedure, which was also complemented by a phlebectomy on the right lower limb. And now she's feeling quite well today, so we can let her go home. I should mention that we ask the patient to stay in Moscow for at least another week, 10 days, so that we can be absolutely sure that your wounds are healing properly. We are especially concerned about the groin area, because it's a zone like the armpits, with excessive sweating, so there's a possibility of the suture line breaking down. But nevertheless, Tatiana is doing well, everything is absolutely dry everywhere. The suture junctions are healthy and pink. There's no sign of any bluish discoloration anywhere. That makes us very happy. Swelling is minimal. We hope it will stay that way. And after these 10 days, we'll be able to send you home with peace of mind.
All right, thank you very much. Natalia Semyonovna, thank you.